Hello, this is Dr. Mercado at Orange States Dental, your local dentist in Downey. I get a lot of questions about dental implants, so I want to spend a few minutes answering the most common questions that we get on dental implants to better help your understanding. So what a dental implant is, I wish I had a maybe sexier or a nicer term to use, but dental implant's a screw. It's pretty much a screw that replaces the root of your tooth. As far as what the implant's used for, is used to replace missing teeth. That's pretty much the gist of it. The good news as far as dental implants, there's few things that disqualify a patient from getting dental implants. A major thing is smoking. Smokers have a higher risk of implant or dental implants failing, so that's one thing. Another situation are patients who are taking medication for osteoporosis, but even then we can kind of get around that. You stop taking the medication, and we've had a situation where implants are placed perfectly fine in that situation with osteoporosis medication. But other than those two things, age is not a factor. That won't disqualify you to get dental implants. That's pretty much it. The good news with the benefits and versus the risk of dental implants is they lean way over on the benefits side. So as far as the benefits with dental implants, well, you get teeth. You ever chew with them, you ever floss with them, they work and they function, they look like real teeth, right? As far as the risk for dental implants, it's very minimal. It's a minor surgery that takes place to place a dental implant. So as far as pain, discomfort, that's very minimal. But as far as major complications or risk for dental implants, they don't really exist. So there's different types of dental implants, and we've come a long way. For the most part, dental implants have changed shape. There was just kind of the way it was put into your mouth. It was screw shaped. There was one that was kind of a blade or kind of knife shape. Sounds kind of scary, but for the most part, as far as the materials nowadays, it's titanium. There's some newcomers coming out, but they don't have the long history and track record of titanium. So how a dentist decides if a dental implant is right for a patient is pretty much with the exam. You look at the patient, you look at the history, you look at a tooth. If a tooth is workable, savable, the majority of dentists are going to go out there and save that tooth for you. But if a tooth is really, really bad and it's in bad shape, and many times the patient kind of feel it or just knows the tooth isn't in a good shape or a good situation, the tooth gets taken out and it's replaced with dental implants. Kind of the way we decide as far as dentists decide on how dental implants are selected for the patient. So there's about 6 steps to getting a dental implant. You may have skipped over or already done one when you take tooth out, but for the most part, you take a tooth out, a bad tooth, you get it ready for the implant by placing some bone that day. It's taken out. Again, fine, you might have skipped that step. The next step is you actually take a special x-ray or a CT scan in a mold of your mouth. From there, onto the third step, you place the actual dental implant, which is that screw. And then we take another mold, and we take a mold for your tooth, for artificial tooth. And then the next final step, we actually place that artificial tooth or the implant tooth into your mouth, onto your implant, and you're done. So as far as options for implant teeth or artificial teeth for implants, it's varied. In the sort of the big piles, you have teeth that are able to be taken out with dental implants, and then the artificial teeth that are kept in permanently. You don't take those out. You use them like regular teeth. You don't pull them out of your mouth. But for the most part, the removable teeth tend to be made of plastic. They can be made of porcelain as well, but the fixed ones or the permanent teeth are pretty much made of porcelain, harder materials like your teeth, and you wear them like that way. So those are pretty much the two sides of the coin there. You have removable teeth you take out with dental implants, and teeth you leave inside of your mouth with dental implants. As far as how long a dental procedure to place an implant takes, it's pretty short. I tell patients 5 minutes. Yeah, your appointment might be half an hour, but if I don't talk very much and I can, which I like doing, I get an implant in less than 5 minutes. So that's pretty quick. It's not a rush job or anything like that, but as far as the modern technology and techniques, we can definitely do the implant and place an implant very quickly. So the procedure is very minor and simple. One common question I get as far as pain and dental implants. So first of all, dental implants don't hurt. There is a minor procedure for surgery, if you want to call it that way, because it is, but it's a minor surgery and procedure to place the dental implant. Very common, very, very common that patients will go back to work the same day or the next day. And it's very, very simple healing. I've had patients tell me with zero pain. Very rare that I have a patient come back and tell me that a massive amount of pain. But for the most part, a dental procedure as far as placing implants is very simple, and it's for the most part very painless. So there's generally 2 anesthesia options for dental implants. One's always done, which is a local anesthetic, when you actually get into your mouth and the area is numbed up, so to speak. And the other option is sort of what we call conscious sedation, where you're actually kind of put to sleep. Now, I will say the majority of my implants, if I've placed in my mouth, or in patient's mouth, the majority of implants I've placed in patient's mouth have been with local anesthetic, not with the conscious, full body sleep. So definitely something as far as dental implant placement, very simple procedure, and it can be done with local anesthetic. One good question I get, and a very good question I get, is as far as how long do dental implants last? Do they last a year? Do they last the rest of my life? So dental implants, honestly, truthfully, can last the rest of your life. Now, a couple of things have to happen that way. One, you have to take care of them at home. You have to brush, floss, all the regular things you do with your teeth, right? And then two, you have to get your checkups and your cleans often and when you're recommended to have those cleans done. If you do those things, realistically, the implants will wear like your natural teeth. You'll use them like your natural teeth. So they will and can last the rest of your life. So one of the big kickers with dental implants is the cost. And it can be costly. We have to kind of balance that out with the amount of time they can last. Now, if your implant lasts 6 months and you have to pay $1,000 or $3,000 for an implant, that's not a good deal. But if you pay $1,000 or $3,000 for an implant that lasts you 20 years or the rest of their life, that's a very good kind of pro and con there. As far as the financing for dental implants, yes, most patients do opt for dental financing for their implants, and it ends up being something very affordable, something monthly that fits in most everybody's budget. With dental insurance plans, most of them don't cover implants. Through my experience, the ones they do will cover part of the implant, some portion of the treatment, part of the surgery, some version of that. So as far as dental insurance and dental implants, it's kind of mixed reviews there. Some insurances don't cover any part of the implant or implant procedure. Some of them do. Some will cover part of the implant, the artificial tooth, some version of that, right? So it depends on your dental insurance. There's no real good or bad dental insurance. It just depends on what they cover, what procedures they offer, and really what your employer sort of decided to take on as far as a dental insurance plan. So the best way to schedule an appointment with a dentist as far as dental implants and find out more information or getting one done is call dentists. That's the best way to do that. So I hope I answered all the questions or most of the questions you had. If you have any more questions or you need to take action and get an implant or you have some concerns about that, give us a call here at Orange 6 Dental. You're a dentist in Downey. It's at 562-659-7246. I hope to see you soon. We're here to help. Thank you.